Hello, welcome to D-Board Exams, Periodontics Practice Review. If you have any questions or doubts, or you need more online practice questions, you can email me on this email below. Okay. All right. So some of these are the key basics of periodontics that you need to know and keep in mind for your correct diagnosis and treatment planning, okay, before you proceed on to take this exam, okay? Because this exam usually you have cases, and most of the cases you're gonna have a period chart, so you have to know periodontics, okay? All right, so here discussed already, so I had highlighted it. It's which of the following is a functional unit or dentogingival unit? Okay, so the answer here is junctional epithelium and gingival fibers. So these are considered gingival fibers, and junctional epithelium as a dentogingival unit. And we're going to see the feedback, which I usually provide in the practice exams. Okay, so answer is A. All right, so here's the feedback. So the attachment of junctional epithelium to the tooth is reinforced by the gingival fibers, and for this reason both are considered functional unit or dentogingival unit. Okay, so the function of junctional epithelium and gingival fibers as a dentogingival unit is to provide epithelial barrier against plaque bacteria. Okay, it also allows the access of gingival fluid or inflammatory cells. The most important aspect also is this junctional epithelium or gingival units exhibit rapid turnover and rapid repair of damaged tissue. This is the reason why the oral mucosa is always healing faster, usually within 3 days, at most 1 week. Okay, especially if somebody has a gingival pathology, which is there for about 2 weeks. Then after 2 weeks, you consider biopsying the lesion because of this phenomena of the rapid turnover and rapid repair of damaged tissue that the gingival tissue has. Okay, so they have capabilities of repairing themselves rapidly. All right, so question 2, which of the following are acknowledged function of circular fluid? Okay, except. So all of the following are acknowledged functions of circular fluid, except which one is the exception? Okay, is it A, assist in mineralization of the tooth structure? B, cleans material from the sulcus? C, improve adhesions of the epithelium to the tooth? Or D, exert antibody activity to defend the gingiva? So what do you think is the exception here? All right, make sure you pay attention. It's saying all of the following are the functions of circular fluid, except. Okay, so which one is the exception? All right, so is it, as of course, as you know, the gingival clavicular fluid or circular fluid does not assist in mineralization of the tooth. So our answer is going to be A. Okay. All right. So let's look at the feedback. So gingival crevicular fluid, which is also called a circular fluid, okay, is represented as either a transudate or as an exudate, depending on the proteinaceous nature of the fluid. So it is a potential use as a diagnostic and prognostic biomarker of the biologic state of the periodontium. in health and disease. Okay, so keep that in mind. That's an important property there. It contains components of connective tissue, epithelium, inflammatory cells, serum, and microbial flora. So make sure you keep in mind the contents of these gingival clavicular fluids. Okay. So in a healthy sulcus, the amount of gingival fluid is very small. That's very important. And then when you get inflammation, now you start getting some transudate and more of transudate, and actually, if it's worse, you can get actually more of an exudate. You have to know the difference between a transudate and exudate. So during inflammation, however, the gingival fluid flow increases. Okay. So what's the function of gingival clavicular fluid? Number one, it cleanses the material from the sulcus. It contains plasma proteins that may improve adhesions of the epithelium to the tooth, and possesses and microbial properties. Also exert antibody activity to defend the gingiva. All right, so these are the important functions. Number three, so which of the following is indication of apically positioned flaps? So the flaps, of course, you can study periodontics without knowing certain types of flaps. Okay, so what's the indication of apically positioned flap in this case? Is it a pocket reduction, resective surgery, crown lengthening, or all the above? So the answer here is all the above. If that's what you chose, then you're correct. Okay. So feedback is apically positioned flap is used for pocket reduction or resective surgery, crown lengthening. This is you reduce bone or the tissue to give more tooth appearance. Okay. Also, mucogingival. Mucogingival is more keratinized gingiva. Okay, so you can use that apically advanced flap to move the keratinized gingiva to where you need it. Okay, e.g. is in implant surgery. Question 4 is, which of the following pathogens are elevated in aggressive periodontitis? This is a key question. Okay, when compared to other forms of periodontitis. All right. Is it Prevotella gingivalis and Aggregatiba actinomycetocomitan, or is it Aggregatiba actinomycetocomitans and strep vilidans, or is it Aggregatiba actinomycetocomitans and Fusobacteria, or none of the above? Okay, so if you chose A, you are correct. Okay, so Prevotella gingivalis, remember it's in the late stage. Okay, and also the aggressive nature has been shown to be associated with the AA. Okay, Aggregatiba actinomycetocomitans. Very long, hard to pronounce. You keep practicing, you can pronounce it too. All right. So answer is A. So let's look at the feedback here. So aggressive periodontitis, the common features, you have patients who are generally healthy, and you have rapid attachment loss and bone destruction. Okay, and usually there's familial nature. All right, so familial aggression, so somebody in the family may have it too. Secondary features, you have amounts of plaque inconsistent with severity of destruction. Somebody comes in, you see they have a little bit of plaque, but the bone loss is severe. Okay. There's elevated aggregatable actinomycetocomitans and, of course, P. gingivalis. You have phagocytic abnormalities. So you have more of the macrophages, okay? Abnormalities, therefore the inflammation levels are increased and causing destruction of the bone. Hyperresponsive macrophage phenotype. You have elevated prostaglandin E2 and interleukin 1B. Okay, so make sure you know which ones are elevated. All right. Progression of attachment loss and bone loss may self-arrest. Okay, so keep those in mind. All right, so moving on to question 5. When compared to acellular, as I mentioned, this lecture or discussion is about the basics of periodontics that you're supposed to know. When compared to acellular cementum, which of the following is correct about cellular cementum? Okay, is it A, contains cementosis, cementocytes, or B, it is more calcified than a cellular cementum? C, it covers cervical third to half of the root. D, or the above are correct. Okay, so you have to know the difference between a cellular cementum and cellular cementum. Okay, just know that cellular cementum has cementocytes. Okay, so our answer here is A. All right, so the feedback here, cellular cementum is also called secondary cementum. Okay, it's formed after the tooth reaches the occlusal plane. Okay, it covers the apical third of the root. It is irregular, contains cementocytes, and it is less calcified. All right, so make sure you know this. Moving on. Question 6. So there are two types of cementum. So when I made these questions, trying to emphasize a concept. When I repeat things, it's because I'm trying to help you remember. Repetition is the key, okay, to either memorizing it or actually trying to know it, okay. There are two types of cementum, the acellular cementum and cellular cementum. Which of the following statement is correct regarding acellular cementum? Okay, so this time we are looking at acellular cementum. Excuse the spelling there, acellular cementum. So, is it A, it is first to be formed, it covers the cervical third or half of the root, it is formed before the tooth reaches the occlusal plane, or the above are correct? So here is D, okay? D is the answer. So let's see the feedback here. So we have cellular cementum, which is also called primary cementum. And excuse me. So acellular cementum or primary cementum, it is first to be formed, has no cells, which is hence the name acellular, has no cells, so it's acellular. Okay. It covers cervical third or half of the root. It is formed before the tooth reaches the occlusal plane, and its sharpie fibers are completely calcified. Okay. So, question 7. Arrestin is. What is arrestin? Is it minocycline? Is it doxycycline? Is it metronidazole? Is it clindamycin? Okay, so here's a brand name, and of course you have to know the actual name of this antibiotic. Okay, so what is arrestin? All right, so arrestin is minocycline. Make sure you know that, minocycline. So our answer is A. This one is a definition, so I'm not gonna give a feedback on this one. So move on to question 8. So fibers that extend from cementum in a coronal direction obliquely to the to the bone are called what? Okay, so fibers that extend from the cementum in a coronal direction obliquely to the bone are called what? Are they called oblique fibers? Are they horizontal fibers, transeptal fibers, or apical fibers? Okay, so here of course the question gives obliquely, so if you chose obliquely, oblique fibers, that's the correct answer. Okay, all right, question 9. Which of the commonly used incisions is used for gingivectomy? Okay, yeah, most of you usually keep this in mind. I know most of you know this, but sometimes it gets tricky when you're under stress. So make sure you review this, practice. Which incision is commonly used for gingivectomy? Is it internal bevel incision? Is it external bevel incision? Is it circular incision? Or is it interdental incision? So in this case, it's our external bevel incision. Okay. All right. So let's look at the feedback here. So the external bevel is primarily for gingivectomy. When we do crown lengthening, okay, or a flap surgery to reduce pockets, we do internal bevel incision. Okay, very short but very important key. All right, so keep that in mind. Moving on. If you have any questions, as I mentioned, feel free to email me. Okay, for any questions, any guidance, or if you need online tutorials or timed practice exams. Okay. All right. So question 10, which of the following is characteristic of junctional epithelium? So we've read some of junctional epithelium already, but so as I just mentioned, repetition is emphasizing an important point. Helps you remember also. So which one is the characteristic of junctional epithelium? Is it non-keratinized? Is it parakeratinized? Is it less permeable than the circular epithelium? Or none of the above are correct? Okay. So our junctional epithelium is non-keratinized, okay, stratified squamous cell. So our answer here is A. And let's look at the feedback here. So junctional epithelium is formed by the joining of the oral epithelium and the reduced enamel epithelium. Okay, it is a stratified squamous non-keratinizing epithelium. Okay, again, the junctional epithelium is a stratified squamous non-keratinizing epithelium. It has 3 to 4 layers thick in early life. Okay, when you look at children, usually they have small layers, but as you advance in age, okay, it can have about 10 to 20 layers. All right, as I mentioned, this junctional epithelium is always rapidly repairing itself. The length of the junctional epithelium ranges from, okay, keep that in mind, from 0.25 to 1.35 millimeters. It is more permeable than the circular epithelium. All right, So keep that in mind. Review the junctional epithelium. Question 11. Which of the following are collagen types found in gingival connective tissues? So this one I mentioned in the biochemistry video, okay, which most of you liked. If you haven't reviewed it, go ahead and review. I review some of the topics that you need to know before you go into the exams. Okay, that's for the people studying for part 1. But remember, now everything is going to be mixed up. Okay, you're going to have integrated INBDE, so everything is going to be mixed up. So make sure you review collagen well. So which one is the answer that is found in the collagen that is found in gingival connective tissue? Okay, so is it type 1 and 3? Is it type 2 and 3? Is it type 1 and 4? Or is it type 1 and type 6? Okay, so here the answer is C. Okay, collagen type 1 and 4 are the ones found in the connective tissue. Answer is C. Okay, it's quite our feedback here. So gingival connective tissue, there are 3 types of connective tissue fibers, okay, which are collagen, all right, and then you have reticular connective tissue. You have elastic connective tissue, which we reviewed the collagen and elastin in the biochemistry video. If you've reached this far and you don't know those, make sure you review collagen types and connective tissue types. So collagen type 1 forms the bulk of the lamina propria, okay, with type 4 collagen branching between type 1 bundles and is continuous with fibers of the basement membrane. The stability of this attachment is a key factor in limiting the migration of the junctional epithelium. Remember, that's why in a healthy gingiva on which is with a tooth attachment, you have probing depths which are at least 3 millimeters or less. Okay. However, when you have implants, okay, you know that the probing depths are increased. Okay, and there's also the differences because of the connective tissue, the orientation. Okay. All right, and you can review those in the implantology section. Okay. So moving on to question 12. Which of the following is not a plaque retentive factor? As I mentioned, this is a review of basics of periodontics. Okay. We cannot study perio without studying plaque, calculus, and the causative factors. Okay. So which one is not a plaque retentive factor? Rough surface of restoration close to the gingival margin, non-restored cavities close to the gingival margin, stippling of gingiva, or overhang filling. Even if you don't know what the stippling of gingiva is, you know the other 3 are wrong because you know all these features are going to retain plaque. So our answer here is going to be C. Okay, that's the answer. C is the answer. So let's look at our feedback here. So plaque retentive factors, okay, you have non-restored cavities close to the gingival margin. You have roughened surfaces or fillings close to the gingival margin. Okay, so that's the reason you have to smooth your restorations. The overhang, make sure you know when you go in these exams, make sure you know how to identify overhang, okay, on radiographs, because you may be asked questions, a lot of questions will say, why this patient has bone loss in this area, or, so you have to know plaque retentive factors and you have to know overhang, okay? And what to do with overhangs, of course, is over-contoured, inadequate crown margins, okay? Over-contouring is a significant factor in gingival inflammation, okay? Whereas under contouring has less effect on gingival health, okay? Because when you're under contour, you can have food getting stuck in between the teeth. However, the patient is able to access, that area and clean, floss. If you over contour it, the contacts become too tight. Food gets trapped underneath. The patient cannot access the food. So then you have inflammation. From the inflammation, you have bone loss, okay? And so you have end up having a severe periodontitis. All right. So portion of the removable prosthesis that impinge on the gingiva can also cause act as plaque retentive factors. So you have to design your partial dentures well, make them smooth, okay? And of course, orthodontics appliances, you have to always reinforce oral hygiene because there's always some gingival inflammation because of, braces retain plaque. All right, moving on. So question 13, which of the following is not characteristic of a healthy gingiva? So you have to know, if you're going into periodontics as a dentist, you have to know what's healthy, what's diseased, okay? If you say somebody, oh doc, my gingiva don't look healthy, but you have to look for certain features of healthy gingiva, okay, for you to tell the patient whether they have gingivitis, periodontitis, okay? So A, is it stippling? That is not a characteristic. Is it a knife edge, which is not a characteristic? Rounded edges? Is it scalloped outline? Okay. So this one, and this one are characteristic of healthy gingiva. You want to see stippling. You want to see scalloped outline, and you want to see knife edges of the gingival papilla. Okay. When they become rounded, okay, it means there's some kind of inflammation. All right. So it means the gingiva is not healthy. So here the answer is C. Okay. So our feedback here, healthy gingiva, as I mentioned, you have to know this, covers alveolar process, it's scalloped outline, has orange peel appearance, which is also referred to as stippling. Okay. It is pale, coral pink in color. All right. Now, it may be pigmented, like physiologic pigmentation in African Americans or other people in the South America. Okay, for example, in Africa. Okay, and also there's alteration in size. Okay, is common feature of gingival disease. So meaning when somebody has gingival or periodontitis, you see some gingival inflammation, some plaque, and everything else. Everything is edematous, okay, erythematous. So you have to know what's healthy, what's diseased, okay. Interdental papilla, the healthy interdental papilla has to fill into the interproximal spaces, okay. Immediately apical. It is immediately apical to the contact area of adjacent tooth. And the coronal portion of the interdental papilla is also called the core. The core is determined by the shape of the contact area. Okay? Key point to remember. In the incisal region of the interdental papilla is pyramidal. Okay? Or pyramidal, or whichever the pronunciation you want. The premolar to molar region papilla are more prominent. Okay? Keep those in mind. Very key important features of periodontics. Okay? Alright. Question 14. Which of the following is not part of periodontium? You cannot evaluate a period disease without knowing what the periodontium is. Okay? So what are the components of periodontium? Is it pulpal tissue? Is it alveolar bone, gingival, or periodontal ligament? So you already know that alveolar bone, gingival tissue, periodontal ligament, they are all part of, all these make up periodontium. Okay. And of course, you know, pulpal tissue is not part of periodontium. All right. So answer is A. So let's look at our feedback real quick here. What makes up periodontium? All right. Quick snapshot. Remember this. Periodontium is made up of gingiva, periodontal ligament, cementum, and the alveolar bone. Okay. Cementum is part of the periodontium. Dentin, the pulp tissue, is not part of periodontium. Okay. Keep that in mind. Number 15. Which of the following statement is correct regarding cementum? All right. A. Is it more organic component than dentin? It continually forms throughout life. It has more inorganic component than enamel. Stops forming when tooth reaches occlusal plane. So which one do we say? Which one is correct regarding cementum? Okay. All right. So if you remember what we said, it continually forms throughout life. Okay. Remember that cementum continually forms throughout life. So our answer is B. Let's look at our feedback here. Okay. So cementum deposition is continuous process, most rapid in the apex, okay, of the tooth. And the condition whereby you have more production of cementum is called hypercementosis. Okay, this usually makes extraction of teeth difficult. Okay, but you see more prominent thickening. Okay, usually on the radiograph, make sure you know how to identify hypercementosis. Okay, all right, so that's it. If you have any questions, message me. Okay, or if you want any additional help in terms of practicing, I believe in practicing. Okay, timed practice exams. That reinforces what you learn. Okay, you can read all day long, but if you're not practicing, then you're not retaining it as much, or you don't know how much you're retaining. Okay, so make sure you review the topics that we've just reviewed, and good luck on your exam preparations.